Hey, good morning, everyone. Welcome to the UroPatient podcast. I'm your host, Vic Sinise. I've been a urology nurse for the last 40 years, and this is my way of giving back. We come to you every Saturday at 10:30 a.m. We're live on Facebook and on YouTube. And YouTube is our best place to go to watch all of our videos. And be sure to hit that subscribe and like button on YouTube. If this is the first time you're watching the show, be sure to check us out on UroPatient.com, our website, where you can learn more about the show. Best place to go to find out more about the show. And it's also the best place to go and get our handouts. Every week, I produce new handouts to go along with the show that we're doing. So be sure to check those out too. This week, we're going to be talking about some Rezum therapy. It's episode 10 on BPH. And it's part of our group of therapies that we call minimally invasive treatments for BPH. So we talked last week about the drugs that could be used, and we talked about what prostate problems actually are, how it's, what we define those as the week before that. So we're kind of in that BPH theme. So now we're going to start doing these minimally invasive therapies. And I'm really happy to say that Dr. Herbert User, who I work with and do these Rezums with every week, is going to be joining us to give a little talk on the Rezum treatment for me. So I'm going to go ahead and bring in Dr. User right now.
Let's talk about Rezum and the in-office BPH procedures. And I'll go through this again in a little more detail shortly. But the way I do all of my office procedures, 99% of them, is a combination of a local block and nitrous. And I'll get back to that in a moment. But what is Rezum? Basically, I tell the patients it's like a cysto, and then through the scope, we're going to inject some steam therapy into the prostate. And it works great. The retreatment rates are really low. The side effects are pretty minimal. The first few weeks are brutal. I tell the patients that. I try to manage their expectations and warn them. You're going to get some dysuria and blood and frequency and dysuria, and all of these things are going to definitely be much worse. The first 2 weeks, I make you worse. After that, things slowly improve. By the time we're at 3 or 4 weeks, you should be getting to be slightly better than you were before. And by the time I see them back at their 3-month, they're going to be significantly better. I'm going to show you this video because I do think it's pretty cool. There's just a few very short videos I'm going to play.
Rezum uses a fundamentally different way of applying thermal energy to treat lower urinary tract symptoms secondary to BPH. Each 9-second treatment uses 0.42 milliliters of radiofrequency heated sterile water vapor, which rapidly and uniformly disperses through the tissue interstices. The condensation of water vapor releases stored thermal energy. Cell membranes are gently denatured, thereby causing immediate cell death. The vasculature is closed, and there is denervation of the alpha-adrenergic nerves within the treatment zone, providing you with an efficient, uniform, predictable treatment. Over time, this ablated tissue is resorbed by the body's natural healing response, reducing the volume of tissue, allowing the urethra to open, relieving lower urinary tract symptoms.
So I thought it also might be kind of cool to show you what this looks like. This is the actual Rezum being done. That little sound you hear, that beeping, is 9 seconds. Each treatment is a 9-second treatment. The white thing is the needle actually going in and out of the prostate, and you can kind of see how it's going to thermally destroy it. So the steam is now going in. You'll hear it counting down for 9 seconds. You can kind of see the prostate kind of turn a little bit white in color. That's the thermal destruction of the tissue. Now we're doing the other side. Typically, we do anywhere from 4 to 6 or 8 of these different treatment zones, but 4 is about average. You see, again, we're in the prostate area. We're going to inject that steam needle again. And so you can see how fast this is. Really, really super quick.
So we watched those short videos. And I'm not going to belabor the point with these studies, but essentially what we're showing you here is that the IPSS scores drop dramatically. the Qmax, how the force of stream works, and quality of life improves. Erectile function is minimally impacted, and really there is no impact. This is probably just the degradation that one would expect with age. Side effects from the Rezum, basically what I've mentioned. Obviously, you can go into retention, clot retention, UTI, and we do see that periodically. You've got to be judicious with leaving the catheter in and how long you leave it in. I personally leave it in for about 3 days, and I will take the catheter out, have the patients take the catheter out themselves at 3 days. Now, if they get a lot of treatments, say 5 or more treatments, then it's going to be longer. If they're in retention when they come in, it's going to be longer. If they're a very elderly, feeble patient that's perhaps in a wheelchair, it's going to be longer. And when I say longer, we're talking somewhere between 1 to 2 weeks. The dysuria is brutal. It's brutal with any of these procedures, but with Rezum in particular, it is pretty rough for that first week or two. So as long as the patients know, you can give them some Pyridium, you can give them some AZO, and that tends to work out pretty well. Here's the reason I really like the Rezum. It's very durable. And this is 4-year data, and I should have mentioned that on the prior slide as well. The 4-year data is now 5-year data that they've published and through the same study. And basically, the retreatment rates are really good. You're talking about a 4 or 5% surgical retreatment rate, and you're talking about perhaps an additional 5% of medication retreatment rate.
So there we have it. Thanks again, Dr. User, for that great talk. So let's go through our 5 H's. How is it done? As I mentioned, it's an office procedure. We do it in the office. Really, how much will it hurt? On a scale of 0 to 10, I'd put it around a 3. 3 mostly because we're using some really good anesthesia for this. The combination, as you mentioned, is a block, what we call a prostate block. So like the dentist gives you a shot for the drilling your tooth, we do that to the prostate. Done through the rectum. It's quick and pretty painless injection too. Then we also use Pronox before that. Pronox is nitrous oxide that the patient is able to breathe that in, and makes you kind of groggy. And so we do that before we even give you the local block. So it really makes the pain level down to maybe a 3 at most. Some people say they don't even know they had it done. How long does it take? This is fast. 5 minutes. I mean, that's start to finish. That's max. That's including putting a catheter in afterwards. How long is the recovery? Well, as Dr. User mentioned, you're going to be miserable for a little while. We say about 2 to 3 weeks. It's going to be, it's like anything else. If you burned your hand, it's going to hurt for a while till that healing process takes place. We're burning the inside of the prostate. It doesn't really tend to feel pain. It tends to get angry with causing urgency, frequency of urination, that type of thing. So as he says, you'll probably get worse and not like us all that much for the first 2 weeks. After about week 3, you're going to start noticing some improvements, and by 3 months, you're going to be, our best friend, because it really does a great job. So that gets to our last thing, is how well does it work? And as Dr. User said, the retreatment rate is very low, and that's our 5-year data. So this is a very effective treatment. That really makes it a great treatment for the office, because there's, minimal pain, minimal bleeding, minimal time, all the things that we like to see in an office procedure. Prep for this is pretty simple. What we do is have patients make sure they're off blood thinners. We are sticking a needle in. If you're on blood thinners, even the aspirin, sometimes you'll get a lot of blood in the visual field when you're trying to see, and you have to be able to see where to put these steam needles. So no blood thinners. Fleets enema the night before, because we're doing that block through the rectum. We don't want a stool right there, so that prevents us from having to cancel it. And we will treat you with an antibiotic as a precaution. So typically, it is given, usually in our office, we give injections, because most of the oral stuff has some resistance out there now. So we want the best thing for you. As we mentioned about the anesthesia, it's a combination. The first thing that you see there is our local anesthetic that's done through what's called lidocaine jelly. It's got a gel, and we just squirt it into the penis, and it numbs it up nicely. That's like minimal discomfort or pain. Most patients just say it feels like you're urinating backwards. The other one next to it is the Pronax, and you can see that happy face on that guy. It's pretty typical. Had the name laughing gas. That was because some people would laugh from it, and I don't know that I've had too many patients laugh, but most are pretty happy. So it does make you feel pretty giddy. And then the third one you see over there is how the probe is put in the rectum and the needle is guided into the prostate. Again, it's 1, 2, 3, 4 little shots and we're done. So it goes pretty quick. It is very similar to what we talked about when I was discussing cystoscopy. So if you look at episode 5 and I talk about rigid cystoscopy, it is a rigid scope that we're using. And that's the actual instrument you see right there. So the size and everything it's normal size. It's not something that's huge that has to stretch out or anything. And there you have it. That's our first wander into this minimally invasive surgery for BPH. And next week, we're going to be talking about UroLift. That's another procedure we do in our office. As I kind of talked about BPH looking like a donut, UroLift is stapling that donut open. And we're going to talk to you about that next week. So join us next week to learn more on the UroPatient podcast. Thank you.